Now to the latest on COVID-19. Many more hospitals across Georgia warning about a capacity crisis. They're running out of beds, while the number of people needing medical care just keeps climbing. We are just 14 days into this new year, and in that time, hospitals across the state have sent 62 patients to a temporary hospital at the Georgia World Congress Center. There are 42 patients there right now. The space is equipped to handle 60 people. Georgia now ranks fourth highest in the country for hospitalizations, with more than 5,700 people in the hospital right now. We have set new records 15 of the past 17 days. The state also marking the second highest day for deaths yesterday, with at least 136 people dying from the virus. Things are getting dire following the holidays here. Paola Suro joining us live now. And Paola, Grady Hospital, one of the largest hospitals in the state, now says it has reached full capacity and could be forced to make some tough decisions when it comes to patient care, right?
Yeah, Shiva, and since Thanksgiving, I've actually been in constant communication with the chief medical officer over at Grady, Dr. Robert Jansen, and he said back then that he feared they were going to run out of bed space in their intensive care unit. But now that worry, that concern has unfortunately become reality. They have run out of space. They are full. And not just in Grady, but health officials say virtually every hospital in the state is dealing with an unprecedented need because of the virus. Right now, 92.8% of ICU beds in Georgia are at capacity. That's a reason why they've had to start using the Georgia World Congress Center just to put patients in as of January 1st. The problem is not only bed space, of course, but also that hospitals don't have enough staff to care for the high number of cases. Grady employees are spread thin, so their CEO says the hospital will have to make tough choices when it comes to providing care. Dr. Jansen also told me back in December that that could mean that people with other emergencies, not just COVID-19, but other emergencies, could be waiting a longer time to receive care. And think about this. This is also as hospitals are also dealing with having to vaccinate their staff. So currently they're just juggling a lot of things at once.